So here we are with Dr. Ellen Vora, and this is the second time that we've chatted. I got a chance to meet Ellen on Instagram Live, and it was a great introduction to what her expertise is, which is really integrative psychiatry, holistic psychiatry. I wanted just to read something from your book that stood out to me that maybe could be a launching point to get us started. Would that be okay?
That sounds great.
So you write that anxiety is not what is wrong with you. It is your body and your mind fiercely alerting you to the fact that something else is wrong. It is evidence that there is something out of balance with your body, mind, life, or surroundings. And with curiosity and experimentation, you can work towards putting these elements back into balance. So let's talk about some of those things today, how we can get back into balance and um, dive a little bit deeper and get a little bit more specific on what that could look like.
Yeah, I mean, it's interesting, right? We really think of anxiety as the end of the inquiry, the final diagnosis, the answer. But what always didn't feel right to me about that is the idea of a diagnosis being the answer harkens back to the glory days of Western medicine, which is really around the invention of antibiotics, where it's like, okay, now we know it's this bacteria. Now we know penicillin is the cure. And so we can walk out of this feeling heroic and potent and like we really helped. And I think we're forever trying to get back to that. And so the idea there is okay, anxiety is the answer. And therefore, what? Therefore, it's a chemical imbalance of serotonin. We have this pill that supposedly corrects that neatly without causing side effects and in a way that's effective. And so we can walk away and say, okay, anxiety was the answer and the pill was the cure. And, well done for today. But it doesn't turn out to be so simple. And so when I see that somebody has symptoms that check the boxes, it seemed to be a constellation of symptoms that come together as something that I would define as anxiety, that's not the end. I don't feel like we have this one solution implied by the fact that it's anxiety. To me, it's the beginning of the inquiry. It's where I start to say, well, what is causing these symptoms is out of balance. And sometimes it's very cut and dry and physical, and sometimes it's quite psychospiritual. And it's a fun journey working with people and trying to identify what are the different idiosyncratic imbalances in their physical body and in the world around them.
So, how did you get here though? Because you were trained in very Western models of medicine. You graduated from Yale and Columbia. And then here you are talking about um, other aspects of anxiety that I imagine you were not trained in your psychiatric training.
Yeah, I think so many people who step out of their training and their pedigree, usually I share with them this a similar story, which is that it really required my own health crisis. But it was a combination of things, and it's not a neat story. It was a messy process in my life. But basically, two things were happening in parallel. One was that I could tell early on in my medical training that even though I was learning how to masterfully medicate patients, I was suspicious that I was not really seeing people thrive. I was seeing people become more intact occasionally, sort of a little bit patched up, but I wasn't seeing people walk out of the work they were doing with me and on the hallways that I was working in, really entering into a fulfilling phase of their life where they were thriving. And so I was skeptical that maybe this wasn't, the bee's knees, how we were approaching mental health. And then in parallel with that was my own health just getting further and further out of balance. And there were points in my medical training where I was struggling with polycystic ovary syndrome and migraines and acne and severe chronic constipation and irregular periods and joint pain and weird rashes, and just everything was off in my body. And here I was learning how to treat people. I was in the hallowed halls of conventional medicine. I was doing everything quote unquote right, but things just kept getting more and more out of balance in my body. So I had to scratch my head and say, maybe I don't have the answers of what creates health in the body. So I ended up pursuing all of these alternative modalities that quickly ended up outclassing everything that was happening in the conventional doctor's offices. One person was giving me like Zell-Norm for IBS, and another person was teaching me yoga poses and breath work. And that was what was actually getting my body back into balance. And so then I also started to learn how to feed myself. I got acupuncture. So it was a series of a lot of little ways of realizing that these more integrative and holistic practices were what moved the needle for me. And then I started applying them to my patients and seeing that was what actually moved the needle for my patients as well. And from there, I was just completely a convert.
So are you still using psychiatric medications, or have you completely stopped prescribing? For some of my clients, psychiatric medications is what allows them to live their life healthily and functionally and have children and not be significantly depressed. How do you balance those two? This idea of, okay, you've seen these benefits of integrative medicine, but also having this training and understanding of psychiatry.
Yeah. Yeah. I do still prescribe medications. I find that every once in a while, it's exactly the right bridge for somebody to walk across to get out of a place where they're really stuck. They take this bridge, they get to the other side, and then we can slowly chip away at getting things back into balance in their lives. Then maybe they stay on the medication, maybe they eventually slowly taper off. But it's been a really beautiful, humbling journey to not be able to have any one dogmatic view on mental health. You know, if I was trained with the dogma of it's a genetic chemical imbalance and you treat it with a pill, and then I switched to the dogma of wait, a lot of mental health issues, the real determinants of them are our states of inflammation and our nutrition and our sleep and our exercise and our connection to nature and community and purpose. And so then I got kind of more into that perspective. But over time, I've just realized sometimes, and then sometimes the med is really what is necessary and helpful. So it's a real blend in my practice. I do tend to think that medications are often barking up the wrong tree. And so, you know, we were sold this idea that they're correcting an imbalance. It's a nice, neat, elegant idea, but I don't think it's completely true. I think whatever chemical imbalance exists is often a downstream effect of a state of imbalance happening elsewhere in the body. So when I meet somebody with anxiety or depression, I want to know what is the true root cause. Is it inflammation? Is it something going on with hormones, a micronutrient deficiency, a thyroid problem? And to just kind of put a medication over that, I find can sometimes obscure the real root cause. And so I really want to identify what's actually going on, address that, and often it obviates the need for the medication.
Yeah, I don't think that the research has panned out in terms of the serotonin hypothesis and the brain disease model of
Mm.
depression and anxiety. It just, as much as people wanted it to, it's not showing up in the research as the explanation, the full explanation of what's going on. So let's talk about false anxiety, true anxiety, and then what you're doing there in terms of assessment and treatment.
Yeah, so I've basically found that that's a more useful classification than what I was taught and what the DSM tells us. The idea that, you know, we should classify anxiety as generalized anxiety disorder or panic disorder with or without agoraphobia, social anxiety, so on and so forth. The idea always with these classification symptoms is it should steer management. And that is valid if your management options are cognitive behavioral therapy or medication. And those aren't really how I'm approaching anxiety. So, a more useful classification system in my practice I've found is this false anxiety? Meaning, is it avoidable anxiety? Physical anxiety, something that's really happening, just it's a stress response in the body, tripped off by something in our diet and lifestyle, and it doesn't really need to be happening. Or is it true anxiety? Is it something that we shouldn't be pathologizing? It's not caused by a stress response. We cannot gluten free or decaf coffee our way out of true anxiety. And it's not just a chemical imbalance either. It's really our inner compass. It's our true north telling us, hey, slow down, pay attention. There's something in our lives, in our community, in the world around us that's really not okay. And we want you to notice this and be with it and take steps accordingly. And and that's our true anxiety. And I think that when I meet a patient, I'm starting with the false anxiety. That's the low hanging fruit. I always want to think first, what is causing unnecessary suffering for this person? What can we eradicate? And so we figure out, oh, is it blood sugar? Is it inflammation? Is the gut, the hormones, a medication perhaps? We look into all of that. We kind of just sort of picture myself wading through the woods with a weed whacker, like we're getting rid of all of that. And then we've cleared a little bit of a path. And then what remains behind that is someone's true anxiety. And then I really switch roles and I become much more of a kind of a midwife or, I'm basically holding space while somebody stays with their inner truth and explores that, gets intimate with it, and starts to really honor it and heed it and figure out where is there a path forward to take purposeful action in response to what doesn't sit right within them.
Beautiful. So let's start with the false anxiety and break some of those pieces down a bit as you do in your book. We spent a bit of time talking about sleep on the Instagram Live. So, folks that want to hear you on your ideas around sleep, I would go listen to that. But there's another arena that I think is quite popular right now and that there's good emerging research around, although it's not fully there yet, which is the microbiome and the gut microbiome access to the brain, right? This connection between what's happening in our guts and how it influences how we feel and how we think. Let's start with that and how you assess for that, as well as what some recommendations are around that.
So the first step is just like understanding the gut really does impact our mood in a number of different ways. And I've been sort of crying this from the rooftops for, I don't know, over a decade. And it really wasn't met with a warm reception 10 years ago, 12 years ago. Now people kind of know. They're like, yeah, I've heard about that. I know. But I always find I'm sort of a, like a science nerd. I want to know why and the mechanisms to really grok it. And so for me, I focus on three mechanisms of why the gut impacts our mood. And one has to do with the fact that our bacteria help in manufacturing certain neurotransmitters like GABA, it's our primary inhibitory neurotransmitter. It's really critical to not being in a constant state of anxiety and doom and gloom is to be able to have that GABA state of relaxation. We're going to be okay. And there are Bacteroides species of gut bacteria that manufacture GABA. So when we take antibiotics, when we don't eat fermented foods, when we're chronically stressed and eating things like sugar, consuming alcohol, this all can compromise our gut flora and impair our ability to manufacture neurotransmitters. That's one. Another is the fact that our gut has this hotline to our brain by way of the vagus nerve. And so we have top down communication for sure. That's the one we all kind of instinctively appreciate. We're nervous and we have diarrhea. We feel on edge about something, we have that butterflies in our stomach feeling. But it's actually bi-directional communication. The gut is also communicating back up to the brain. And if everything's okay, it can send a signal. Everything's copacetic down here. Go have a great day. But if we just took a course of antibiotics for a UTI and the gut flora is decimated and things are inflamed, it's going to send a really different communication up to the brain. It's going to say things are really not okay down here. You'll be tired. You'll feel uneasy. You'll feel malaise and just a feeling of, ugh, it doesn't feel good in my body. And that's, probably intended to motivate us to rest so our body can heal, maybe drive us to consume slightly different foods. But a lot of us just go through our lives chronically inflamed in this way and chronically having this message up to the brain something's not right. Don't feel good today. And the last piece is that the gut is so critical to our immune function. And when we have a diverse ecosystem of bacteria in the gut, that is going to help train our immune system to recognize the difference between friend and foe. It helps us have tolerance, and it basically helps our immune system stay in it. I think of it as not dysregulated. A lot of what's going on in modern life is a dysregulated immune system where we're attacking things incorrectly, attacking our own tissue with autoimmune disease, overreacting to benign stimuli like in allergies, and all of that comes back to the health of the gut. So, for those reasons, the gut is important to anxiety, and there are things we can do to heal our gut. And I
Yeah.
outline that pretty comprehensively in the book, but there's a lot we can do for ourselves on our own. And it's not that hard. We just have to give it some attention.
So, what's interesting is that when our babies are born, they have zero microbiome. They get all of it from the vaginal canal and then eventually from skin to skin with the mother and then from the world of crawling around and getting it from the floor. And it's something it's like this thing that we develop over the course of our lifetime. And then there's on the one hand, I think we live in a world that's so focused on cleanliness. And the other hand, we see, okay, there's all this benefit to bacteria. And I think that people are a little bit confused. You know, it's like, well, wait a minute. So you're telling me there's good bacteria. And then I was actually talking to my dentist about it yesterday. I was in the dentist chair and he was putting a cavity back in that fell out. And he was like, yeah, maybe we just don't need to be so clean. I was like, okay, wait, hold on. In this dentist chair, it's very good that everything is clean, but maybe it's better if we don't have to like dip our vegetables in like bleach before eating them, that they actually come with some good bacteria and good stuff on them when they come from the farm. And so some of that is, I think, confusing for folks of how we replenish and support our microbiome without getting sick.
Yeah. Yeah. It's still a slightly nascent field, this idea of like psychoneuroimmunology and understanding the role of the gut microbiome in this. But basically, if we know anything, I think we can stand on the fact that diversity is beneficial. A diverse ecosystem of bacteria and viruses and parasites and fungi in the gut. And so, what I think is an important compass is to basically invite germs and fear chemicals. And I put that message out a little tone deaf at the wrong timing, sometime in the pandemic, and it sort of got swept away as a political message. And it really was never meant to be that. It wasn't a commentary on COVID-19. It was a commentary on the very idea of, when my daughter was crawling around on the floor at her music class as an infant, some moms would instantly kind of like spray down her hands with antibacterial. And to me, I see that as, there's chemicals in that, there's preservatives, there's BPA. I would actually rather that she get the bacteria that are on the floor and put that in her mouth and start to seed her gut with a diverse ecosystem. I brought my daughter to a farm when she was really young. And I thought to myself, like, yes, crawl around here, get this in. So, we're culturally conditioned to think like spray everything down, keep it hygienic and clean. And of course, that's it's so well intentioned and we can understand why we thought that way. But the chemicals are in many ways more harmful. And the bacteria and the germs are in some ways needed and missing in our modern microbiomes. And so, just to kind of tip our biases a little bit and to get back to encouraging some of that good exposure to a broad array of flora.
Mm-hmm. Yeah, everything from let your dog lick your face,
Mm-hmm. That's the
because
best.
our microbiome kind of matches our pets to some degree. And
Yeah.
um, both of my children were born via C-section. Given that, I was always really conscious of wanting them to be exposed to things like digging in the soil and picking up the chicken eggs and just kind of being exposed more to a diversity of microbes. And because they didn't get that initial dose of it. So
Yeah.
that's wonderful. And it's emerging, the research around being able to use things like probiotics for anxiety. I'll put some articles in the show notes around specifically the link between the microbiome and anxiety that people want to take a deeper dive into that. But some of the suggestions you make are also just how we eat. So making things like fermented foods as part of your diet, as well as not being so germ phobic, except for in the dentist chair. I think it's
Yes.
fair. Use those
Great.
chemicals, friend.
And I'll be honest, when I get home from a hospital shift, from an airplane, I instantly shower and autoclave my clothes. They're not all germs.
Okay, so another aspect of false anxiety that you talk about is hormones, and I think in particular for women, I don't know if we understand why this happens, but for many of us, we see our anxiety increase before our menses, or maybe we notice that we can't sleep during certain weeks of our cycle. Certainly, there's a link between postpartum and anxiety. So there's something going on there, birth control, all sorts of things that are happening. But because it's in women, obviously, that leads to the patriarchy and us not talking about it. And I think that it'd be helpful for you to break that down. If someone's coming in and you suspect hormonal aspects to their anxiety, what are the things you're looking for and how do you address that?
So this is a complex topic. Overall, actually the first message that I want people to take away is that the that fluctuation through the course of our cycle is not inherently pathological, and that's not something, I don't think it's wrong. I think that we have a cultural perception of how we act and feel and behave in those days before our period, that like you're so irritable, you're such a, I won't curse right now, but people use all kinds of choice terms to describe us in those days. I think that we really need to reframe that. That is truth serum. It's a time when we have much less tolerance for BS. We feel a stronger sense of indignation about the injustices in the world in those days. This is very important to leverage that feeling of conviction that we can feel before our periods. There's a yin and yang to this. Like that's valuable. And the fact that in our follicular phase, the sort of days after we start bleeding, when things kind of roll off our shoulders and we're just rolling with it, that's also useful and also lovely. We might have more energy and feel more social in that time. So what I most want is for women to just at least know that they have these different phases of their cycle and be in touch with it, and I think structure our lives around it a bit. I
Mhm.
really try to do that. I try to live in rhythm with it, not try to squeeze myself into the mold of this very masculine cycle world, but actually to mold my life into my more feminine monthly cycle. And then I do think that there's a false anxiety component to hormones for some of us. It sort of feels to me like, how could there not be? Because there are these assaults in modern life on our hormones. Everything from the fact that we're exposed to xenoestrogens, or kind of an excessive dose of estrogen, through pesticides and plastics and air pollution and personal care products. We'll put lotion on our body that mimics estrogen, and it gets absorbed into our bloodstream and can act on our hormone receptors. And then that's even more exaggerated by the fact that chronic stress and certain nutritional deficiencies and things like cholesterol can make it harder for us to make enough progesterone. So that ratio of estrogen progesterone, it's exaggerated in modern life, and that can make those days before our period even worse. So I'm here for the luteal phase. I'm here for that dip in our mood. I think that it's not fun, but it's important. But I also think a lot of us are suffering unnecessarily because of the state of so-called estrogen dominance. So I do help my patients slowly make sure they're not getting exposed to so many xenoestrogens, slowly support their body making enough progesterone, and that tends to help hormones get back into balance.
And birth control plays a role in this. I think that as much as as women, we want to support the use of birth control and the importance of that, and the freedom that birth control has allowed women. But at the same time, I see a lot of teenagers starting very early on birth control, and then they come in see me in their 30s and they're wanting to have kids, and they've been on this birth control for 15 years.
Yeah. As a public health measure, fantastic. On an individual level, it's a longer conversation. And
Mhm.
I think that when if a 14-year-old needs birth control pill to serve as a contraceptive, I think it's a pretty good option. I think when a 14-year-old goes to see her pediatrician and she's getting acne and her periods are uncomfortable, the fact that we slap on that band aid, that doesn't sit right with me, because it's not a solution. It's not actually addressing whatever underlying causes are contributing to a state of imbalance for that woman. It's basically, it's a band aid that creates some of its own problems over time. And we do now have data to say that, especially if we start or hormone like oral contraceptives in adolescence, it's more likely to have an impact on states like depression and anxiety later on. So that's uncomfortable. And I think we have to be really honest about that, especially in the wake of decades of the medical gaslighting that was happening to women about the fact that they're reporting to their doctors, I think I'm weepier, I think I'm sad on this pill. And doctors saying, well, there's no evidence for that. This is in your head. And so I think we need to be extra validating and aware of the fact that if this seems to be impacting somebody's mood, my inclination is like it is. And we need to take that really seriously. So, and for that 14-year-old, I want to know what's contributing to her acne and her irregular or very uncomfortable periods. And I want to work at that to make sure that we're getting her health and balance early. And we miss
And
that
sometimes
opportunity
acne is part of your developmental process,
for
just like
sure.
weight changes is part of your developmental process, and we need to medicate those things away. Yeah.
Absolutely.
So it sounds like you take a similar stance, with psychiatric meds or with birth control, that it really is individualized care and that you're open to looking at all the options, putting all the options on the table, as opposed to just assuming sort of like a one track, this is the solution that someone's going to come in and I'm just going to give them this medicine to make this thing go away.
Yeah.
Yeah.
Yeah. Every phase
Great.
of life, a different birth control, I think, is the appropriate choice.